I want impress, and I want to carry my love.
WASPEN 2023 Conference, Innovative Nutrition Support to Eradicating Malnutrition. According to Ann Wigmore, the food we eat can either be the safest or most powerful form of medicine or the slowest poison. This was the epic focus of the two-day clinical nutrition conference organized by the West African Society of Parenteral and Enteral Nutrition, WASPEN, to inform about the importance of nutrition support. Speaking on the conference, the founder, CEO of WASPEN, Dr. Teresa Pounds, said the rationale for the event was to avail participants information about malnutrition and the know-how to screening patients and making appropriate recommendations, and be informed about other different initiatives of care. Excited about the event, she said, "This is a big day for Nigeria and of course Africa, because through WASPEN we have the opportunity to tell that we care about malnutrition and how it affects the people."
It's a big day for WASPEN. And why is it a big day? It's a big day because we have the opportunity to tell the world that we care about malnutrition. We care about discussing what we should do to make malnutrition not to be a topic for anybody. So we're here with a group of individuals to talk about how can we screen our patients both in the hospital and the community and identify their nutritional status on time, and also how to discuss the different initiatives on how to take care of them. So it's a big day for WASPEN, and I think it's a big day for Nigeria, for West Africa, that finally you have an organization that is really very keen about making malnutrition a thing that will not be a reality. So I'm very pleased to be part of this and looking forward to a very good conference.
Malnutrition is real and nutrition is human rights. Speaking on the aftermath of the conference, Dr. Pounds said WASPEN expects all health personnel to be champions of nutrition support in their various fields. She also expects Nigeria to take the lead in Africa to push good nutrition support for all.
My expectation is that Nigeria will take the lead to make the initiatives that other countries in West Africa will follow. The lead in terms of, like I said, identifying patients who are malnourished, the lead in terms of making sure that the products are there to take care of these patients who are malnourished, and that other West African countries will look at what Nigeria is doing and follow suit. So that is my expectation, and that as a team meaning physicians, pharmacists, nurses, and dietitians, that we all work together to make sure that, we're taking care of these patients, because malnutrition is real and nutrition is a human right. And that's the message we want to pass out.
The conference, which was tagged Innovative Nutrition Care in Resource-Limited Settings, held on the 20th and 21st June 2023 at Necker House Event Center, Alausa, Ikeja, Lagos, with dignitaries across healthcare, professionals, researchers, and students to brainstorm and share knowledge on latest innovative developments in clinical nutrition. At the event, the President, Pharmaceutical Society of Nigeria, Professor Cyril Usifo, ably represented by Dr. Egbuna Udora, Deputy President, PSN South, expressed his joy and gratitude to WASPEN for the great initiative, which he said calls for attention and support of everybody as it is beneficial to all. Professor Usifo asserted that there is no better time to discuss nutrition issues than now. He specifically congratulated the organizers of the Clinical Nutrition Conference, which he assured of PSN's support.
The message from Pharmaceutical Society of Nigeria is like look into it, that we look into it and see a role pharmacists will play, especially in production of enteral and parenteral nutrition products. Because no matter what, if it's not available in the country, people will definitely not use it. So we implore all pharmacists, especially those in industry and research, to help in developing products, Parenteral and Enteral nutritious products that be used for patients, especially patients in the hospital, that will definitely need.
Prince Julius Adelusi Adelui, president of the Nigeria Academy of Pharmacy, was the chairman of the conference. He was impressed with the event, which he described as necessary and timely. He congratulated WASPEN and the management team for the laudable project, which he said will help much for human nutrition. The chairman asserted on what good nutrition is to the body and the key to human existence. He urged participants to ensure good nutritional value of food at all times for healthy living. If you don't make food your medicine, medicine would be your food. You're simply what you eat, he cautioned.
Today's occasion, because sometimes unless God blesses your efforts, in vain you do all the sweating. Well, here we are, good ambience, good attendance, and good participants. And I can congratulate the leadership as well as the membership of WASPEN. And I think WASPEN is quite fortunate this time, particularly pleased.
Keynote speaker for the event, Mrs. Claire Omaseye, president of the West Africa Private Healthcare Federation, was apt on the imperative for strong advocacy for good nutrition. She harped on the need to fight malnutrition and poverty as they bring misery to mankind, while calling on all to share the beautiful initiative of WASPEN to make the desired difference. She advocated for collaborative support from other agencies, both public and private, to develop this initiative and the need to recruit more dietitians and nutritionists in health centers across the country. She urged healthcare givers to do more on healthcare than sick care.
Privilege of speaking today as the keynote speaker, and really I think WASPEN has done an amazing job. Advocacy is not an easy task. Collaboration is the only way we can change things, or the narrative in this case. Their focus is on nutrition and making sure we can have more research and development locally in sub-Saharan Africa, as well as educating the populace. And today you've seen fantastic speakers lined up that are really opening up the importance of nutrition, the challenges of malnutrition, and what we can do as a collective to be able to change the narrative to access to quality health in Nigeria. So I think that WASPEN is doing a great job. They should keep up the advocacy, they should keep up making sure we can influence policy, and that together, speaking with others, we can change the narrative, working alongside government. Government plays a critical role, and we need to be able to work with government to be able to do this, and WASPEN is doing a great job.
Also at the event was the famous healthcare researcher cum policy maker, Dr. Peter Adigwe, DG CEO, National Institute for Pharmaceutical Research and Development, NIPRD. In his presentation titled Building the Gap, Opportunities for Advancing Nutrition Research in Sub-Saharan Countries, Adigwe harped on the increasing trending needs for healthcare and the opportunities to be explored in the sector. Dr. Adigwe went further to explain how research can lead to improvement in healthcare services and the numerous advanced research NIPRD had embarked upon. He stressed the achievements in NIPRD of different laboratories which were required through several interventions. While commending the efforts of WASPEN, which he described as lofty and valuable to the full nutrition gap, he challenged WASPEN to advocate for legislation and policy formulation in Nigeria and emphasized that the initiative should not only be restricted to West African countries alone, but also to become ASPEN to cater to all African countries. He asserted that malnutrition affects the vulnerable population, particularly in Africa, where it is highest. Adigwe challenged the pharmaceutical sector to rise to the occasion as resources were readily available to make Nigeria to play the leading role in Africa. He extended NIPRD's hand of partnership to WASPEN to forge ahead in the nutrition initiative.
About the opportunities that exist in the sector for advancing nutrition R&D. And Claire has done very well in setting the scene. So a number of the slides where I would have talked through, I will just skim over them so that we can save time. We all know about severe acute malnutrition in the entire spectrum of nutritional.
Another speaker at the conference was Dr. Adedakpo Oshinowo, Senior Lecturer in College of Medicine, University of Lagos. In his presentation titled Building a Multidisciplinary Winning Team to Beat Malnutrition in the Acute Care Setting, a Physician's Perspective, he built on the need for medical professionals to leverage on working in synergy to save more patients. This, he said, was necessary as they were all interdependent. He emphasized the importance of nutrition in patients' health because however good the physician is or does his work, poor or bad nutrition will mar his efforts because a malnourished patient cannot respond effectively to treatment. A malnourished, therefore, needs nutritional support before and after theatre operation. He said this will help to give the best for the patient to get better. Teamwork of all interdisciplinaries will ensure better results. Every patient, therefore, needs nutritional support, he said.
Sort out the patient intraoperatively and potentially post-operatively, your outcome is not going to be good. So it's not your technical skills alone that matters. What's also very important is you being able to assess your patient pre-operatively. You as a surgeon, you're going to, and if it's been shown that if you're going to operate a patient and you've assessed that this patient I'm going to operate on is not likely to eat for the next 5 to 10 days, you had better start. Can you see the number of days they used?
The panel session of the conference was a synergy of robust interaction on the subject matter of nutrition. The panel consisted of hospital pharmacists, community pharmacists, dietitians, physicians, nurses, and health technician specialists. The different clinical specialists on the edge of specialization bore their minds as they related with nutrition management in their respective healthcare centers. This was in line with the advocated synergy among clinical professionals. The interactive session had participants asking panelists related questions which were really contributory to intellectual knowledge. Members of the panel included Dr. Yeseun Asieba as moderator of the session. Others were pharmacists Vern Ohaya, Mrs. Olukemi Omoyeni, Farm Folashade Lawal, and Dr. A.O. Oshinowo. Another rewarding session of the conference was the Nutrition Screening and Assessment Skills Lab Workshop. The essence of the laboratory workshop was to train and empower participants to screen patients for malnutrition and make appropriate recommendations. This, according to the organizers, was to equip participants with the requisite skill and tools to recognize the gap in malnutrition and the strategy to fill it. This is very important to help participants fit into the nutrition support and care initiative. Participants were issued certificates for the short course of malnutrition screening and support. Dr. Yeseun Asieba, clinical pharmacist and board treasurer WASPEN, expressed her excitement for the conference focus and the caliber of people in attendance. She stressed the need for collaboration among healthcare professionals because every health worker is very important in improving the nutrition status of patients. She said this was necessary because nutrition plays a key role in the recovery from diseases and remaining healthy.
WASPEN International Conference is the second inaugural one held in Abuja, and we thank God that we are building on it. So far so good. It's been a beautiful ceremony. The caliber of people that came in here is really exciting. We had our chairman, Prince Julius, we had Dr. Claire. They just performed excellently. The deliveries were excellent, and we have a lot, cut out for us as WASPEN. So it's been beautiful so far.
Dr. Leo Egbujiobi, member of the board of directors of WASPEN, was excited as he described the conference as showing the role of nutrition and recovery from diseases. He appealed to participants to seriously engage in the conversation so as to become better agents on the message.
Today is WASPEN second convention. It's a worldwide organization innovative in thinking and recognizing and building capacity on how to affect the life of sick patients in a hospital, and defining the role of nutrition in recovery from disease and also in prevention from disease. So our speakers across the globe being hosted by our dear Nigerian colleagues. And we are confident it will be great again.
Leoshni Dwaka, Regional Director of African New Age International, South Africa, drew on the significance of the innovative conference and assured of their organization's readiness to partner WASPEN to achieve the vision and goals of the organizers. She was all smiles as the conference offered her opportunity to create awareness for their products in Nigeria.
As an opportunity to create awareness of these products that we provide. It is a cause for malnutrition, and we believe that our colostrum products are very beneficial to malnutrition because it cleans the gut, which is the cause of many of our diseases and illnesses and viruses. So we want to create this awareness and put it out to everybody, especially here in Nigeria, because we already have many consumers who are using our products, and there's fantastic testimonials on how it has.
Jacob Nwachukwu, President Blood Pressure Control Foundation, described the conference as one emphasizing on our fundamental human rights, which is the right to life. He said we can only have that right when we are properly fed with adequate nutrition. He added that being alive is not enough, but must be physically fit and mentally balanced.
That the number one fundamental human right is the right to life. We have to be alive before we can defend any of the other human rights. And for us to be alive, there must be nutrition. Without adequate nutrition, we can't be alive. And why? Because being alive is not the only issue, but to be alive and why. In other words, we have to be healthy, medically fit, mentally sound, and physically.
The wealth of experience shared among participants at the conference cannot be taken for granted, as everyone had something great to take back to his or her community. Dietitian Mrs. Ahigbe Evelyn from Niger Delta University Teaching Hospital, Bayelsa, confided to CEO Africa that the conference was quite beneficial to all because of the informed innovations and the experience learned. This is one area most healthcare providers don't give adequate attention to. Now we have been informed about the need for nutrition support and cooperation among healthcare professionals for efficient services to patients.
Conference have really been mind-blowing. It has been a period of brainstorming as the theme of the conference says. It is a nutrition care in an innovative nutrition care in resources and limited environments. But much more than the limitation of the resources, we have also talked about collaboration. We have looked at the patient care as what is very important, their nutrition status, and we have also looked at how the dietitians, the pharmacists, the physician, and the nurses can collaborate in a nutrition support team to be able to bring out the best outcome in a patient, and especially the critical care patients. Like we discussed during the conference, there are specialized nutrition care and non-specialized nutrition.
Another participant, pharmacist Stephanie Obibi, expressed her gratitude to WASPEN for the novel initiative. She prayed for more such scientific conferences where healthcare experts meet and add to the body of knowledge.
Attended the conference, the WASPEN conference has been wonderful, really wonderful. From the beginning, the speakers so far, the keynote speaker, Mrs. Omache, really did very well. And nutrition went on another level. I've not really seen it in this light, but it was really mind-blowing.
WASPEN is a new innovation.
Richard Longe, representative of New Age International South Africa, called it a conference with so much innovative benefits for Africa to gain from. He said more than ever, Africa needs to take nutrition support more seriously to help eliminate or reduce malnutrition.
I'm expecting good things. It's high. We had a pre-meeting discussion with Dr. Pounds, and she's very excited. The company is very excited. We hope that today's event is not going to be the last one. Our goal is to take it to the next level and partner with WASPEN to achieve the vision and the goals of the organizer.
On the seamless organization of the conference proceedings, the local organizing committee members credited it to the spirit of teamwork among members. Dietitian Wright Olabisi, chairperson of the local organizing committee, and Tevin Klein, project director, revealed that adequate and timely preparation were put in place with all required support from WASPEN. They promised participants more value in next year's conference, that's the WASPEN 2024 conference.
Success. It is the success, like the speaker that it is not the multitude, but those people that come, you know, the people that represent are so, jam-packed in knowledge, and those people that participated have really gained a lot, you know. People have been telling me, the feedback I've been getting is that they are interested, they want to collaborate with WASPEN. So this gives us joy that all the things that we are doing is bringing out positive outcomes.
This is my first time.
Majorly, I'll start by saying we caught the vision of our founder, Dr. Teresa Pounds. So she recognized that there is a gap in nutrition care in Nigeria, and she called us together, shared this vision with us, and gave us strategy on how we can be able to fill this gap. So we became very intentional in our involvement to help spread the word about the incidence of malnutrition in clinical settings, both for hospitalized patients and even in outpatient care. So we all drove towards this vision to be able to achieve it. So it's not just a personal effort, it's a very, very big team effort, because like our organization says, we are actually advocating for interdisciplinary team approach towards
There was product presentation from different companies. As the Clinical Nutrition Conference came to an end, Dr. Teresa Pounds, founder CEO of WASPEN, was excited for the accomplishment of the conference. She challenged participants to go and become nutrition support ambassadors in their various communities and institutions. You have become a champion. When you become a champion, you identify with other champions to sustain the nutrition support. That is how best we can grow and trend the vision. Anybody can become a champion of nutrition support, she said.
It's hard to explain how I feel at this point, but it's a beautiful feeling. And what makes it gratifying is that this is taking place in my country, Nigeria, and that this is a way of giving back to my country, and the support that I've received from key dignitaries and noted people in Nigeria. And I think most importantly, that malnutrition, that message is finally passed on. And I'm extremely hopeful that something beautiful is going to come out of this, certain actionable items. So it feels good, and I'm hopeful that we're going to have some positive results.